Hi, my name is Dr. Ellen Chiocca, and I am the author of Advanced Pediatric Assessment, published by Springer right here. It is in the 4th edition right now, and it is a book that is written expressly for the advanced health assessment of children. And the reason that I wrote this book was because I was teaching advanced health assessment to family nurse practitioner and pediatric nurse practitioner students about 20 years ago. And the only book that addressed pediatric assessment was a pocket book that was written in outline form. It was small enough that it could fit in your lab coat, but I wanted a full-length text. So there was a representative, a sales representative that came to the university where I was teaching, and I asked him if he had one that was, or knew of one that was full length, because what I was teaching from was one of the classics that already exist. And how it works is it addresses history and physical taking of the adult, and then at the end of the chapter, there's about a page and a half. Oh, by the way, if you have an infant, oh, by the way, if it's a young child or a teenager, you do this. But it's much more detailed than that. It's much more complex than that. So he said no, he did not. But then roughly 2 weeks later, he showed up to my office and said, here is a packet to write a book proposal to write a book like this. And I thought he was kidding around, and he wasn't. So I spent the summer working on it, and it was accepted, and I did it. And the reason as I said, the reason I wanted to do this is I wanted to start out with a chapter, and chapter 1 in this book talks about it, lays the groundwork for why with every age group in children, infants, toddlers, preschoolers, school-aged children, and adolescents, there is something different about the history, the psychosocial stage, and the physical development of the child that needs to be taken into consideration. And that there are critical sensitive periods of time in development. There are specialized knowledge and skills that you need for each group. So the child's age, their developmental stage and level, their past medical history, and their temperament need to be taken into consideration. There are some children that on paper should be able to be examined on the table by themselves, but they're extremely sensitive and shy. So they would need to be examined on their parent's lap. So I explain in the book how the provider can sit face-to-face with the parent, knee to knee, and create sort of a table with their laps to do some of the exam on, not the entire exam. The history varies greatly according to the child's age, who is giving the history. So, for example, obviously an infant can't give their own history. But once a child becomes around 11, there are some sensitive psychosocial issues where we need to give the child a choice to have the parent in or out of the room. And the physical exam is different according to the child's age. Hang on to the book after you graduate, or if you have bought the electronic version, you can pull it up on your phone and look things up while you are in the clinical area so that you make the best decisions that you can.